Statins are among the most studied medications in all of medicine, not just cardiology, but all of medicine. And there's absolutely no doubt that they work. We started the segment talking about how there's been a decrease in cardiovascular deaths, and statins have probably been the workhorse of that decrease, or one of the workhorses. And so I think it's very clear that they're effective. Just to give you an example, so there was a meta-analysis, which is a study of multiple studies, looking at 170,000 patients. And if you decrease your bad cholesterol, your LDL, by about 40, that equates to about a 22% risk reduction in terms of heart attack and stroke, and a 10% decrease in mortality. So those are for patients treated with statins. So they're very effective. And then we can get into sort of the side effects and some of the issues that patients have with them.
There's all sorts of new treatments coming out that may prove more effective, but right now they're prohibitively expensive. You know, a statin is something that even on some of the generic pharmacies, you can get a prescription for $4 a month. You know, so even if you don't have insurance, it's something you can afford, and it's going to be a very potent medicine that can reduce your risk of having future events. And some of these patients we see in the clinic, we may start them on initially to prevent heart attacks. But once you've had a heart attack or once you've had a blockage, these are medicines you should take the rest of your life. And it's a challenging topic because patients don't like to take medicines, understandably. I mean, who likes the idea of saying, I need a pill the rest of my life? But everything we do in medicine is to reduce your risk of future events. And so it's individualized whether you want to take that pill to reduce that risk, but in general, we strongly recommend it. But a lot of patients are led astray. A lot of stuff on the internet is negative. And while there are some side effects to be aware of, mainly muscle aches and joint pains, that doesn't happen to the majority of the people. And just like anything else, is sometimes the most loud or what's making the most news isn't always what's accurate.